Hi, my name is Allie and I'm a clinical dietitian here at UnityPoint Health Allen Hospital. Today we are going to review the basic principles of a heart-healthy diet. A heart-healthy diet is important because it can help prevent or slow down the progression of heart disease by reducing risk factors such as obesity, diabetes, hypertension, high levels of your bad cholesterol, the LDL, and low levels of good cholesterol, or your HDL. Now, there are four main principles when talking about a heart-healthy diet. Number one, reduce sodium intake. Number two, increase fiber intake. Number three, reduce saturated fats. And lastly, number four, limit the added sugars. First up is sodium intake. Excessive sodium in your diet can lead to fluid retention, which puts extra pressure on your heart and blood vessels. The recommended amount of sodium per day is 1,500 to 2,000 milligrams. Now, I know your first thought is probably going to be, I don't add salt to my food. But did you know that 75% of the sodium we eat is hidden in our food already? And that the average American is consuming double the amount of recommended sodium per day? Let's take a look at some of the most common foods high in sodium in our diet. For example, bread has anywhere between 150 to 250 milligrams of sodium per serving. This can of soup, 1,500 milligrams in this can alone. So that's already basically your recommended amount. Fast food such as hamburgers, burritos, pizza, all are going to be high in sodium. Lunch meat, another one that's very common and high in sodium. And this last one will probably surprise you, is frozen dinners. Now this one even says healthy choice, and there's 600 milligrams of sodium in here. So think about what you're consuming in your diet now and try to reduce the amount of sodium by 1,000 milligrams. That will have a significant impact on your heart health. Foods can still have a lot of flavor without the addition of salt. Any seasoning in the seasoning aisle that does not contain the word salt in the name is sodium free. For example, try garlic powder versus garlic salt. Mrs. Dash is another great seasoning alternative, and there are several blends available. Up next is fiber intake. Now, fiber plays a key role in helping lower cholesterol in our bodies, as well as promotes good colon health and blood glucose control. Fiber is found in foods such as fresh fruit and vegetables and whole grains. On a heart-healthy diet, the goal is to consume around 25 to 30 grams of fiber per day. A serving of fruit or vegetables can have anywhere from 2 to 8 grams of fiber per serving. It's no wonder the American Heart Association recommends you consume 8 or more servings of fruits and vegetables per day. Now, besides getting in your fruits and vegetables, there are some other ways to increase fiber in your diet, like trying brown rice instead of white rice. This will add about 3 grams of fiber per serving. Or switching to whole wheat pasta, 6 grams of fiber per serving if you switch to the whole wheat. And lastly, try to find cereals that have at least 3 grams of fiber per serving. Up next, let's talk about saturated fats. Saturated fats are solid at room temperature and are found in foods that come from animals. So you want to think meats and milks. The goal is to consume no more than 5 to 6% of your daily calories from saturated fat. So, for example, if you follow a 2,000 calorie diet, this would be about 11 to 13 grams per day. To help reduce saturated fats in your diet, try limiting the portion size to meats to a 3-ounce serving. Now that's about the size of the palm of your hand or a deck of cards. You can also try to find 90-10 or less ground beef, or choose the loin or the round cuts of meat. Choose low-fat dairy, such as skim or 1% milk, cheeses made with 2% milk or less. And also, I always get the question, butter or margarine? Well, take a look here. We have a tub margarine that has 1.5 grams of saturated fat per serving versus the stick of butter, which has 7 grams of saturated fat per serving. So both are pretty high in saturated fat, but if you have to choose the tub margarine more often. I also want to mention healthy fats, as not all fats are bad fat. Unsaturated fats are actually heart healthy and can help lower cholesterol levels. They are liquid at room temperature, so think of oils. Some sources of unsaturated fats include avocado, nuts and seeds, and fatty fish, such as tuna, salmon, or mackerel, and oils like canola oil, olive oil, and soybean oil, just to name a few. Lastly, let's talk about the added sugars. Added sugars are found in sugar-sweetened beverages such as regular soda, juice, and sweet tea. They are also found in candies, baked goods, and ice cream. Added sugars can contribute to elevated triglycerides, blood glucose, and obesity, all of which are risk factors for heart disease. The goal for added sugars is to limit them to no more than 25 grams per day for women or 37.5 grams per day for men. Now for reference here, a 12-ounce can of regular soda has 41 grams of added sugar. To limit added sugars, try replacing some of your sugar-sweetened drinks with things such as sparkling water, unsweetened tea, or even these little water add-in packets. These are all great alternatives and have no added sugar. Try adding spices such as cinnamon, nutmeg, or ginger to your foods to enhance the flavors. And lastly, save on the traditional desserts for special occasions and grab a fruit for a snack more often. So now that we have reviewed the basics of a heart-healthy diet, it's up to you to decide what you are willing to do for your heart health. Maybe just pick one change you want to make and go from there. Remember, small, simple changes will add up and have a significant impact on your heart health over time.